Are we ready to start? Amazing. Um, Good afternoon, everyone. Um, it always is exciting to speak on a forum, but I think here it's extremely special because it's life full circle for me where I'm coming back to my hometown. Thank you for the kind introduction. And I just thought I will show you, for me, I've moved out of Delhi 10 years ago and I've set up my own practice. But what is really good is that I'm blessed to actually have a beautiful work community and lead a really good full life, but have access to a varied range of equipment, which allows me to be equipped to deal with the talk today, where we talk about multiple modern ultra-wide field cameras. And the main in the industry that we are looking at are the IK AIOS, the Claris 700, and the Optos. These vary in properties, and I would like to see this from the patient's perspective, but then also bring forward what the doctor sees. So this is the image that you'd often see your orthoptist capture, but this is what the patient sees, quite a clown face. But don't be fooled. What we do see, instead of just seeing a traditional fundus camera, we are seeing the whole wide field. This is how far we have come from the initial evolution from 1851, when ophthalmoscopes were first found. So it's important to have to be able to pick up asymptomatic pathology in the periphery. This is my own fundus photo on a wide field image, and you can see how the book opens up the moment we offer ultra wide field. Again, this is the image on the AIOS. The previous one was on Claris. And again, the moment we use the ultra wide field module, you can see a whole new world opens up. So there was a lot of ambiguity in the whole nomenclature relating to wide field imaging, and the study group met up in 2019 and labeled wide field as beyond the vortex vein ampullae, which is up to beyond 100 degrees, and ultra wide field, which is further beyond. So up to vortex vein is wide field, and beyond that is ultra wide field. And this is how two modern day cameras today appear, AIOS versus Claris. So again, just a peek into what a wide field versus an ultra wide field image looks. Now, how this came into discussion is when we started doing ETDRS grading for diabetic retinopathy. And here in this image, you can see how AIOS would compare on an ETDRS chart. And you can see that it actually covers most of the fields, just leaving out a little bit superior and inferior. This is just a two-shot image. And there are lots of areas which are left out in other fundus cameras, which the AIOS is able to capture just with the two shots. Similarly, comparing it with the Optos, you can see there's all the lashes, which is easily overcome with certain properties of AIOS, which I will come to in a minute. So the landmark study that really helps us understand these concepts was this by Federico, which outlined the extent of peripheral imaging, the acquisition time, and the chromaticity, which guides the image quality. What the key findings were that the AIOS does provide us a superior image quality with automatic smart mosaic montage feature. It does take a bit longer because it uses 3 shots compared to Claris, which takes 2 shots. But the interoperator variability was much less, considering it was automated. And what was most striking was that it had a superior image quality because it was the only imaging modality which uses true color using white LED light, which reflects the natural spectrum. And then it was truly confocal, where we are able to actually filter out the impact of media opacities, eyelashes, or even the choroidal glow. So in this image, we can see how an Optus wide field compares to a standard Claris photo. You can clearly see that more is visible on an Optus. But what is missing is the resolution and the image quality. So that's where AIOS steps in and offers a ultra high image. And for that, we go back to understanding what is the true color with the white light, where it is actually illuminating the retina with the entire visual spectrum and also receiving the entire reflected spectrum, unlike the other modalities. And then it has a wider representation of the red, green, and blue color spectrum, which could be seen on this graph, where we can see that it is more centrally distributed with a wider representation. So being a true color imaging modality, but also being a truly confocal system where a thin beam of light is reflected to scan the retina, and then the light reflected by a single plane is what is caught on the camera, offers its unique property of being truly confocal and offering a superior image quality. So here we can see the central fundus photo, but the moment sort of you get out in the periphery, often we lose resolution. Here you can maintain the resolution both centrally as well as in the periphery equally. So it's more reliable with a true quality of vision. Brief comparison of what an image would look like on a Claris, Optos, and an AIOS with pseudo colors in Optos, more red saturation in Claris, while a true, more natural looking colors with AIOS. Let's not leave Claris behind. It is definitely an exceptional fundus imaging system, again offering good range of image clarity all through, but as we can see on the photos, it looks different, and that's because of the broadline fundus imaging, where it separates the light that illuminates the retina into the red, green, and blue channels, with the retinochoroidal tissue being more red saturated and therefore being a bit more red. It is partly confocal, so it's able to avoid the lashes, and you can still get clear images, but it does have a more sort of red glow from the choroid. So another important feature to consider is the time taken. We know Optos is much shorter at the loss of the resolution of the images. Claris, just a bit longer. AIOS does take a bit longer, but it's still almost just a minute and fully automated, and therefore is it too much of an ask to actually achieve a good image quality is what we need to ask ourselves. This is what a smart mosaic looks like. It takes under a minute to achieve this. One benefit of the Zeiss platform is you actually have live visualization where you can actually see the pupil size and the infrared image to help capture, and that does sort of translate into a more patient-friendly workflow. So let's look at some images which I've captured through my AIOS, and here we see a small PED, which is so well delineated. This is a very interesting case where I had patients with AMD following up for injections in this eye, but then presented with vision loss in the other eye, and very, very beautifully captures the area of non-perfusion. But over time, I loved monitoring it every month and saw how you could actually see the same area perfused with the sclerosed vessel in the same area. So excellent visualization. Again, use the same fundus camera to help show my patients why I need to treat them even they have 6/5 vision. My patient here with mild diabetic retinopathy but circinate retinopathy in an area causing focal leakage and responsible for, and then advocated focal laser for it instead of anti-VEGF treatment, which brought the message home for the patient, because otherwise they often wonder why you want to offer treatment. Similarly, another patient who had quite advanced diabetic retinopathy and decided not to get treatment. This is what he ended up with a year later, extensive neovascularization and lost a complete vision with a painful blind eye and neovascular glaucoma. So again, brings back the message home why we need treatments. This photo is really close to my heart. It almost feels like I can go grab that hemorrhage there. It is a pristine quality, and I feel just looking at this, we know that this is an amazing imaging modality. Again, another image showing inferior non-perfused area, head-to-head comparison with another patient I had who also had ischemia. And similarly, just a difference in color is what I want you to have a look and know that this is how it's different. Few images from Claris, I'll be brief minute. So macroaneurysm, CFAN neovascularization, which would have been easily missed. This patient was actually referred as diabetic retinopathy, but later diagnosed to have sickle cell. So largely, this is the summary slide, which is, I think, what tells us that the difference is what you need to see, what you like for your practice, what matters to you most. Is it the image quality? It is the time of acquisition, and how you want to manage your patients with that. Thank you.
Thank you very much.